I'm Dr. Scott Fuller. We're going to talk about feet and common foot conditions that people ask me about when they come into my office. So we're going to discuss plantar fasciitis, bunions, turf toe, neuromas. I'll talk a little bit about neuropathy, unstable ankles. I'll work in there a little bit about hammer toes and a little Achilles tendonitis as well. So that's what we're going to address here. And I want to start off with plantar fasciitis, which is the most common thing that people ask me about, so I wanted to start there. And I give a lot of homework with plantar fasciitis, so that's what I'm going to show you here. Before we begin, a little bit about plantar fasciitis. First of all, we want to make sure it's a correct diagnosis. There are other things that mimic plantar fasciitis. The hallmarks are, of course, pain right in the bottom of the foot, right at the base of the bottom of the heel. Pain that tends to be much, much worse with the first few steps in the morning. And if you sit for a while and then you get up, the pain gets worse again. So those are hallmarks. You can have radiating pain from that heel area in towards the toes. It can wrap to the back of the heel and so forth. If you already had a diagnosis of plantar fasciitis, you might have been to a podiatrist or a PT or something. They may have taken x-rays. You may or may not have a bone spur. That's all fine. We have some good recommendations there as well. The other secret tool that we have is systemic inflammation. Systemic inflammation can be a common cause of plantar fasciitis along with other singular joint problems around the body, but we're going to leave it to the foot at this point. So if you're doing all these stretches and exercises, which we're going to get into in a moment, and you're not getting better, look at your entire body as systemic inflammation. And then we need to do the dietary thing, the water thing, the supplement things, the chiropractic and spine thing, and so forth, right? Okay, so systemic inflammation. The recommendation is, unless you have a really good reason to have surgery now, plantar fasciitis that is, you want to do everything you can to avoid surgery, right? So you want to do the chiropractic stuff, the acupuncture thing, for plantar fasciitis. You want to do massage therapy. You want to do the clean eating and supplements that I had mentioned. Try it all before you do surgery. I find that most people simply get better with these strategies, okay? For chiropractic now, just before I get into the exercises, we have a variety of techniques available. Now, not all chiropractors work on extremities. I do. I've chosen to because I've had a variety of foot and knee and shoulder things. So I'm into this. And I do manual adjustments on certain people. I have a small drop table in my office, very, very light force activity that helps people. We do instrument adjusting. A lot of these are done for acute and chronic sprained ankles. There's a spine contribution, right? So if the spine is off, even way up here, it has a trickle-down effect. Your pelvis is off. You have functional or structural short legs that will throw the feet off. And then you have plantar fasciitis on one side or both sides. So we can do all of that. We can look at short legs. We can address that functionally or structurally. I do soft tissue techniques, deep soft tissue work. One of them is called Graston. You can look that up on the web. Another one is called ART, or active release. You can also look that up. And the last thing I do is cold laser. Cold laser. That's a treatment in my office. I have a therapeutic laser. Again, you can look it up on the web. Cold laser, or low-level laser therapy, and one of the first FDA-cleared treatments for cold laser was for plantar fasciitis. So check that out, and I have one in my office as well. Okay, so let's get into some home treatment and exercise. First one. So let's say that we have pain on the left foot, and it's right in the heel, and it's a classic plantar fasciitis. Let's say no one has disputed that. So what I tell people to do is use a baseball. Definitely a Red Sox baseball. They work better than any other baseball. So use that, put it on the floor, and you simply roll your foot on it like so. Okay? So what you're essentially doing is giving yourself a deep tissue massage with the baseball. There are many other techniques that you can utilize, and structures and equipment and so forth. There are foot rollers that you can use. There are all kinds of contraptions that are available. I just tell people, use a baseball. Almost everybody has one. So go ahead and do this. The beauty of doing it when you're sitting is you can regulate how much pressure you're putting on the foot, and the idea is you're giving yourself a deep tissue massage, you're breaking up scar tissue, you're increasing blood flow, you're getting a little bit of neurosensory feedback as well, okay? So you can use a baseball and you can regulate the pressure. If there's more pain near the heel, you want to focus around those areas with as much pressure as you can handle. If you do have circulation issues and you've been instructed not to do something like this, then certainly listen to your doctor and don't do that, okay? But most of you, this will be just fine. So you roll around here. Make sure you get all areas of the foot too. Make sure you get that ball into the arch, the inside of the foot, the outside of the foot. Get it near the toes as well. Take a few minutes and do that per foot. Even if you only have plantar fasciitis on one side, you can do this on both feet. I do this all the time as a maintenance technique, as a preventative. So I have this baseball at home, at my home workstation, and I just work my feet while I'm doing other things. And so I tend to do this almost every day. Now, if you don't have a baseball, I've got a couple of other things here. Here are those dryer balls, right? It just dawned on me. Well, you could use these. If you don't mind the hard, knurly things, some people will like this, some people won't, okay? This one happens to be a little bit softer. This one happens to be a lot harder, okay? So you could use that, definitely a different sensation. If you don't like the prickly sensation on there, you could do this with a stocking foot, but I do prefer bare feet just to get a better feel for it. So you could use a dryer ball if you wanted to in a pinch. There are ones that you can buy online. This one is called Rubz, R-U-B-Z. So it's not quite as sharp points as well, and that looks pretty good. Yes, you can use a golf ball. Some people ask me about golf balls. Sure thing, you can use a golf ball if you want to. You can use a softball. Now the reason I'm not saying a frozen water bottle is these balls here that I'm using have a lot smaller contact surface. So you tend to get into the nooks and crannies of the foot and the plantar fascia and so forth by using these different techniques here. That's why I like these better. You can use a frozen water bottle. I'll get into that in a minute. So I always tell people start off with this. Do it every day, a couple of minutes per foot, maybe a couple of times a day if you want to, okay? Secondly, what you want to do is warm up the ankles as well before you're going to get into the next one. So you might do some foot flexion back and forth like this. You might do some ankle circles as well, because as you know, the calf muscles and the Achilles tendon are related to the plantar fascia as well. Okay, so in a moment, we're going to talk about this as we move along. We're going to be stretching this area out. So before stretching it, you're going to warm these up and get some blood flow into those tissues. The next thing you can do before we get into calf stretches is if you have any of those rollers, one of them is called the stick. So it looks like a rolling pin, if you will, right? So you could roll that, or you could also use the foam rollers and roll out the legs to get a little bit of blood flow in there too, okay? Then you're going to move into stretching the calf muscles, okay? So when you stretch calf muscles, an easy way to do it is a book. So my baseball is going to be a book. And you're going to stand like this. And imagine my foot is on a book, okay? So you're going to be stretching the calf like this. A couple of things that I recommend. Number one is do 1 foot per time, one foot at a time. And you're going to be stretching the calf in two ways. Number one is, let's say I'm stretching my left calf right now. I'm going to do it once with the knee locked like so, and I'm going to do it for 30 seconds. And then I'm going to do it with the knee bent for 30 seconds, and then I'm going to repeat on the other side. Knee locked, 30 seconds minimum. Knee bent, 30 seconds minimum. And that's what we're going to be doing here to stretch out the calves. Now, why are we doing that? Because there are tissue connections from the calf muscles and the Achilles into the plantar fascia. So you want to keep that area stretched. Don't stretch in the morning when you're cold. This stretch is to be done later in the day, in the evening, after workouts, or like we just talked about, after those tissue warm-ups. You roll your foot on the balls first, you do the tissue rollers if you're going to do that to your calf and legs, do some ankle warm-ups like this, and then you stretch. So you want to be doing stretching a little bit later on into your treatment here, okay? The next thing you're going to do in the evening, if you want to overnight, is you're going to use a night splint. A night splint for plantar fascia, plantar fasciitis. Okay? So a night splint kind of looks like a ski boot. And you'll see them. I was on Amazon last night to see what kind of night splints that they have out there. And there are dozens and dozens. Okay? That's great because the night splints that some of you may have tried are the really big, bulky ones. And a lot of people have told me, I can't sleep with this thing on. It's too heavy, and then this leg crushes that leg, and all kinds of stuff, right? If you look on Amazon carefully, you'll see that some of them are a lot smaller now. They're cloth-based, and they just wrap around the ankle, and then there's a fibrous attachment from the foot to the shin, which keep you stretched like this all night. So in essence, what you're trying to do is put a stretch into the plantar fascia all evening while you're doing this. It's not an aggressive stretch like stretching your calf, but it's a mild stretch all night. Some people respond to a night splint, some people don't. Play around with them, but look online if you're going to go there and see if you can find one that's less cumbersome so it's not as huge as a ski boot. Ice, you can certainly use ice in acute stages, but ice should be the last thing you do before you go to bed if you need ice. You would do your foot rolls first, the tissue warm-up, the ankle warm-ups, the calf stretches, and so forth, and then you would ice down the bottom of the heel. How do you ice down? It's very simple. Put an ice pack on the floor, put your foot on it. Just leave it there for 20 minutes while you're reading or watching TV or watching my show or whatever you might be doing. Just make sure that there's a thin layer between the ice pack and your skin. You don't want to put your skin directly on the ice pack. So icing down for 20 minutes is fine. If you're in a more chronic state and you're not terrible in the morning, when you get up, then maybe you don't need an ice pack at night. But if you're waking up consistently with bad pain in the morning, try the ice at night, again, as the last thing that you do. Then you're going to need a biomechanical assessment. You're going to need a biomechanical assessment of your feet, your pelvis, your spine, and so forth, as I alluded to earlier. So as you can see with me, I'm just going to stand up here and you can see me. So there's my feet. You can see that I have pretty darn flat feet. And I've known this forever. So even back in high school, my chiropractor, 37 years ago, whatever it is now, he gave me orthotics, which helped me move like this. Now, some people have too much arch, so different scenario. I have loss of arch, which encompasses more people. So biomechanically, I actually do very well with arch supports. I get custom molded orthotics, and I put them in my work shoes. I put them in my cycling shoes, even my running shoes, and so on and so forth. That tends to help me, and I've tried to experiment not having them, and they just work for me. Some people they work, some people they don't. It's a work in progress, and there you go. The last thing I find too is people can have a structural short leg. So the gold standard of a structural short leg is to take a standing x-ray of the lower back and pelvis that catches the femur heads, a standing x-ray. And then you can actually see if there's a long or a short leg. I happen to have a short leg. Most people do, to at least a certain extent. And if it's a structural short leg, usually the only way to correct that and help that is with a heel lift in your shoe. What we also find, this is a generality. There are caveats to this, but on the long leg side, my left leg is longer, so on the long leg side we tend to have more problems. So if people have plantar fasciitis on one side, it typically, but not always, is on the long leg side because that side is simply under more compression. So then you have to address that. Some people respond to a heel lift, some don't. That is something that I experiment with, and sometimes we hit a home run, which is terrific. Okay. That's it for plantar fasciitis. Now, there are some stretches in the bunion section that I'm going to show you in a moment that are going to be applicable for plantar fasciitis. So, I'm going to show you some additional stretches for bunions, and the plantar fasciitis people, you can use these stretches as well. Bunions are typically the growth of bone here on the outsides of the big toe. Some people get them on both sides, some people get them on one side. Okay? And what we tend to find is it's a biomechanical issue, and there can be muscle imbalances and so forth. So what happens typically is the big toe will deviate outward like this, and then we walk, 30,000 steps a day and run and work out. And what happens is, with this biomechanical change, is bone starts to grow here in the body's innate effort to try to stabilize the area. Well, the worse that this biomechanical issue goes on and the longer it's there, the more things hurt, the more uncomfortable it gets. Sometimes these get painful. I've seen people with big bunions with no pain at all. I've seen people with toe deviations and very little bunion formation with a lot of pain. So you get a mixture of reactions there. But you can see, again, the most common deal is the toes go like this. So one of the best things that I like to tell people to do, which is really easy, is toe spacers. Toe spacers. So you can go to a pharmacy, in our area here it's CVS and Walgreens and so forth, and they have these tiny gel toe spacers that would be only one section of this thing here, just a small toe spacer that would go right between the big toe and the second toe. And in some cases you get a second toe spacer that would go between the second and the third. And you can see what we're trying to do here is line up the mechanics of that big toe a little bit better. Okay? So gel toe spacers, and they tend to easily fit in shoes and sneakers and so forth. So you can wear those all day. Some people will wear them at night with socks around them to keep them in place, particularly in the colder months. Okay? Sometimes the gel toe spacers, even without socks on, will stay there at least maybe all night or maybe part of the night too. So you can check into those. Gel toe spacers. Now the second thing is a device like this. In many cases, this is called yoga toes. This is not yoga toes, but it's a yoga toes wannabe, or it's a very likeness of that. And what you would do is you feed all of your toes in through here, and you would do this for periods of time. Now, again, depending on your condition, I wouldn't necessarily wear this all night. Some of you can tolerate that all night. I wouldn't recommend starting with it all night. But you can see the same thing. We're trying to spread those toes open. And this feels fantastic even right now because our toes and our feet tend to be just jammed in shoes all day long. And of course, the more pointy, the nicer looking the shoes, the worse they are for us, right? So the pointier the shoes, the more it collapses the foot down. And of course, that would change that to this, right? And then that would promote that bunion formation and some other things in a moment. So a yoga toes or likeness. Again, you go to Amazon or anywhere else. You can even go to, I'm sure, shoe stores and pharmacies will have different structures like this. Okay, so you can try that as well. You can do the foot stretches that I recommend in the plantar fasciitis section. Any of these stretches are good for all feet, not just people with a particular pain or diagnosis. Okay, here's a couple of others that I like. I just call this one spreading the toes. So I am pretty good at this because I've been working on it for a long time. Many of you are going to try to spread your toes like you're trying to spread your fingers like this. You're going to try to spread your toes and you're not going to get anywhere. Okay? And I found this with many of my patients. It's going to take some practice to be able to do that, to be able to spread your toes open like this. I think it's a nice function to bring back into your feet if you don't have it. Or if you still can do this right now pretty well, is to keep it. A couple of things you want to try is try to spread the toes on a plane. Don't try to let them curl in different directions. Try to spread them open, again, like you're trying to spread them like you're spreading the fingers. Okay? And then you would hold them for several seconds, whatever you can tolerate without causing pain. So this is spreading the toes. Okay? When you do get home after work and you can take your shoes off and socks too, it's great just to do this, just to give those toes some freedom. And that's going to help us with neuromas in just a moment. Okay. Here's the next one, lifting the big toe. So isolating the large toe, the great toe like this, and lifting that up by itself, I think is another nice exercise to be able to do. Again, I'm pretty good at it because I've been practicing for some time. So I can lift the big toe up like this. If you have a big, bad bunion, you're going to have difficulty doing this possibly, and it might actually be painful. So use your judgment, listen to your body. Only do this if this is tolerable. Another thing I want you to practice is don't look at the toe and do it, and then try to do one side at a time. So isolating the large toe. That's a great thing to do. Another one I like is walking your toes across the floor, like this. So if you've been watching my show for some time, of course I have all kinds of spine exercises that I show people, right? So while I'm sitting in the morning and the evening and I'm doing my spine stretches, I'm walking my toes across the floor as well, right? Kind of gets your brain going too. You can see smoke coming out of my ears right now as I'm doing this. But so I'm walking my toes across the floor just to give them some great action and activity. And then at the end, I'll spread my toes, again, while I'm doing my other spine exercises. So I'm doing both at the same time. And my spine extension exercises while I'm spreading my toes, and then, again, walking them across the floor. So you can incorporate them together. Short foot. So short foot is another one I like to do, and this one is particularly important with people with flat feet, is you put the arch back in. You've seen me do this already. So what I'm doing is I am putting the arch by contracting the muscles on the medial part of my leg and pulling the arch up and holding. We call it short foot because you can actually see that it shortens the length of my foot here a little bit. Shortens it a little bit when I pull that arch up. So we call it short foot. And you can practice this over time standing, where you can actually do a short foot like this. And you want to try to do it, and I'm doing an okay job, but I am involving the toes. You want to try to do it in the midfoot only without recruiting the toe muscles to do this eventually as you get better at it. And you want to hold this with extending the time that you can hold this as well. This is, again, particularly good with people that have fallen arches. So short foot. The next thing about bunions is spending a little more time in bare feet. I don't think we do that enough, or at least sandals in summer months and so forth. And lastly, another thing that will help the plantar fasciitis, the bunions, and even the other things that I talked about, that I'll be talking about, turf toe, neuromas, and so forth, is ankle stabilization. So if we don't have enough ankle stability in here, sometimes we need some ankle strengthening. Okay, and I'm going to show a simple one here. You should only be doing ankle stabilization if you're cleared to do so, and you're cleared by your doctor, your therapist, your chiropractor to do this. And you do it safely. Be smart. Don't have sharp things around you like tables and chairs and lamps that you could bop your head off of when you're doing this. And I prefer having people doing it next to a wall. So let's say I'm going to do the right foot in this case. I would just simply lift my left foot off the ground just a tiny bit. Why a tiny bit? Not up here, because it takes longer for me to bring it to the floor in case I'm going to fall. So just here. And I try to do it with the short foot. I'm lifting the arch, keeping my spine up tall, little contraction in the core, okay? And then you try to hold it, okay? I'm not the most stable or unstable person. You can see I'm working pretty good to keep myself stable there. And then when you get fatigued, tired in that ankle, you can switch, okay? Now in some cases, I am teaching ankle stabilization on one side, depending on the person and the presentation. I work with a lot of kids that have learning and behavior disabilities, ADD, ADHD, and autism, and they tend to have brain issues where one side of the brain is stronger than the other, so I'll give them a lot of coordination-based exercises on one side. That's one reason I would only do it on one side. Let's say if somebody has, you're an athlete and you're perpetually spraining one ankle, or you're having turf toe on one side, or all kinds of problems, neuromas on one side, we may also choose to only do that on one side. But maybe you're going to do it on both if you have not been evaluated and given these instructions, okay? So some ankle stabilization. Now, of course, this is a simple one, right? That's a simple exercise. You can get all kinds of complexity into your ankle stabilization routine. We don't have time to get into that today, but that would be a basic one that helps all the structures around the ankle get better, and the foot, which is going to help these foot conditions. Okay, turf toe. Turf toe usually talks about the large toe, and it typically is with athletes, and it's usually a repetitive strain of the big toe. So it's a lot of sports that you're pushing off and running and going in different directions, okay? So I've had good success with turf toe with chiropractic adjustments. So oftentimes the joint itself is dysfunctional, almost like you'd get that in your neck or your back. So we can do adjustments on the toe itself. Then we can do our tissue work. I do some of the Graston work where I use tools, and I'll be working the soft tissue to break up scar tissue in the soft tissue to get that joint moving, okay? Other reasons for turf toe, particularly if it's on one side, is again, we have that brain imbalance. So in the chiropractic neurology circles, we would evaluate for that, give certain exercises on one side or the other side. In the chiropractic orthopedic world, they have all kinds of stabilization exercises that they can utilize as well. But with turf toe, I give a lot of the same exercises. Toe spreading, lifting up the big toes, short foot. I will have them roll on the balls again. Again, that's just going to get the function of the entire foot getting better to try to prevent this. And sometimes there are even little exercises that we can do for the toe, depending on the direction of the sprains and where the weakness is and so forth. But I've had some good success with a handful of turf toe cases with the chiropractic work. Sometimes, again, you need supports. If you have biomechanics, like let's say one foot is much more flatter than the other one, and this happens to be the side that's getting the injury repetitively, maybe biomechanical issues need to be addressed on that weaker side, if you will. The next stop is neuromas. Now, neuromas tend to be hence the word nerve or neuroma, tends to be a nerve scar tissue problem, typically between the third and the fourth toes. It can be between the others, but typically here, and it tends to be between that knuckle right in here at the end of the foot where the toes start. And these tend to just rub together, and they cause scar tissue, which then makes that area larger, which presses on the nerve, and that can hurt like a son of a gun. So it's kind of like a funny bone being active all the time. And if you've had a neuroma, you know what I'm talking about. So neuromas, they tend to have a fairly good response to our treatments. I do manual adjustments, and then we get better shoes, and shoes that crunch you here is going to be a serious problem. We open up the toe box in dress shoes and running shoes or whatever you're doing. Bigger toe boxes tend to work. The toe spacers we talked about earlier can help. The yoga toe spacers can help that situation just to give some freedom in there. The soft tissue work that I had mentioned. So we're dealing with the same scenario of getting the biomechanics of the feet back right. But I have found manual chiropractic adjustments, and sometimes I'll get in there with my hands and do all kinds of joint mobilization in there too, which is going to help a lot with neuromas. Neuropathy. Neuropathy is a situation where you're getting pins, needles, tingling, burning, aches, pains, whatever it might be, in the feet, and it typically is from, let's say, diabetes. Okay? There can be other reasons for neuropathy, and I'm not talking about disc injuries in the lower back where you're getting a radicular pain or a nerve root compression where you then get burning in the foot. I'm not talking about that scenario. I'm basically talking about when the nerves are sick and damaged from blood flow issues and sugar issues and so forth. So, is it helped with chiropractic? Sometimes, but we tend to have to employ the other issues that we were talking about earlier. How are you going to take care of somebody that has blood sugar regulation issues? It has to be nutritional. You've got to clean up the diet. We have to stop eating things that taste good, and we have to start eating things that don't taste good. That's the way that we're going to get these things better, right? And then we have to do exercise to that individual's tolerance. Then, depending on the condition of the feet and the blood flow that that person has, depending on where your condition is, if you get clearance to do a variety of these exercises, that can help some of that neuropathy. It may slow down the progression of the neuropathy because you're getting that neurosensory feedback from all the work on the feet going back to the brain. And then you're going to cause other stabilization activity in the feet and the movement and the motion. It's just going to make your feet feel more alive. So the connection from the feet to the brain and the brain to the feet is better established, stronger nerve pathways. But in the case of neuropathy, if it's a blood flow issue, a diabetes issue, the only way to solve that is going to be the nutrition thing and the exercise thing, and then water and get off the juice and the soda and all of these types of things, okay? Lastly, the unstable ankles that I just wanted to mention, we're in the same deal. If people have repetitive strains in their ankle, they need to start working on the feet and the strength and so forth so we can get these activities working better. And so all of the stabilization exercises that we have here can really work to stabilize somebody's ankles if they're getting repetitive strains, particularly if they're an athlete. So thank you to Lauren and Jennifer for tonight's show. I'm Dr. Scott Fuller. Please join me again.